Sir, there is
How?
at the bottom of the screen, you may find the share button, sir. You just need to click on that. Inside, you may find your PPT if you have opened somewhere.
Movimento.
At the bottom of the screen, you may find the share button. You just need to click on that.
Compart.
There is a share button, sir. At the bottom of the screen, you may find the share button.
A share button.
Yes, sir. You just need to click on that.
Sorry. Opa. Conectando. Cancelar. Where is the share button? I don't see it.
It's okay, sir. We have an alternative option. You can send your presentation to our email address, sir. We will try to present it on your behalf. Is that okay for you, sir? You can send your PPT to our email address. I hope you have our email address.
I will to send you the presentation.
Yes, sir. Please send your presentation to our email address so that we can present your slides on your behalf.
All right. Can I the PowerPoint or a PDF?
Anything is fine, sir.
So I would prefer a PDF because.
Yes, sir. Yes, sir. Please send that PDF to our email address.
All right.
Yeah. So please send your PPT to our email address, sir. In the meanwhile, we will continue with the next speaker. So in the meantime, please try to send your PPT to our email address.
Yeah, I will. Just in a moment. Just in a moment. Esqueci-me de fazer isto. So, to Jessica, I can. To
Yes,
Jessica?
sir. Yeah, to Jessica, you can send it, sir.
Yeah. Apresentações, Singapura, Nursing, Singapura. Isto aqui é o PDF, não é? All right, I've sent it.
Yeah, please give
I've
us a
sent
second,
it.
sir. Yeah, we are trying to check it. Please give us a second.
Did you receive it?
Yes, sir. We're trying to check it. Please give us 5 seconds.
All right. Ainda estou a tempo. Faltam 4 minutos.
Isso há sempre traços, uma coisa dessas.
Mas você viu aqui onde é que é o...
Sim, não está muito explícito.
Não se consegue ver. Será isto aqui?
O quê?
Isto está sendo transcrito.
Não, aí o partilhar cá em baixo.
Aonde?
Aqui é este botãozinho aqui em baixo azul que a gente há bocado falou.
Este? Será?
Isso não é o partilhar?
Não sei. Partilhar é compartilhar. Foi com...
O outro lado é o quê já agora?
Não diz?
É o que está. Especialmente é o que está.
Did you... It's okay? Did you receive?
Sir, we have received your PDF file, but that is not a PowerPoint presentation, sir. It is just our program page.
You didn't receive?
I have received it, sir, but the PDF contains only our program. It is not your PPT. Yeah, please try to share
Yeah. Sorry.
Yeah.
Okay. Proceed. is Jessica, yeah?
Yes, sir. The correct email address only, sir.
Yeah. I know. Sorry. Opa, eu já sei o que foi. Epá. PowerPoint, PDF, neurologia. Isto é quê? Solis.
Enfermagem.
PowerPoint,
Siga por enfermagem.
enfermagem. Isto é quê, né?
Sim.
Okay, just send it again. The
Okay, sir,
correct
please
one.
give us a
I'm
second.
sorry.
Yeah, sir. We will check it, sir.
Epá, ainda vai a tempo. Eu tinha com a mesma denominação o programa.
É para ela ver se batia zero. Ai.
Olha, isso foi mais um livro que eu.
Vinha na espingarda, que falava daquilo lá da.
Epá, não.
De Gondo, né?
Epá, não.
Mês.
Eu vou falar disso.
Ah.
Epá, você pode ficar aqui se quiser. Fica aí.
Não, eu queria trabalhar.
Vai ver. Is this correct? Did you receive it? Para mim entrar a hora. Para mim entrar a hora. Did you receive it? Peraí, já está.
Sir, please take a look at the screen, sir. This is your PPT, right? Sir, can you see the screen?
Yeah, I can see the screen, but
Yeah.
now the screen was changed. I don't know. It says.
Should I need to go to the next slide, sir?
No, I don't see my presentation. Yeah, I see it now. So you have to tell me when do I have to start.
Sir, please go ahead, sir. Right now we're starting your talk. You can just continue with it. But please let me know when I need to go to the next slide.
Okay, can I introduce myself now?
Yes, sir. Please do that.
Okay, I'm going to start my presentation, and I would like to welcome and be recognized for this kind invitation. So you can move the slide, please. So I have to say that I don't have any conflicts of interest. The only one that I have is to take care of my patients. Okay, move. Sorry, I said to move the slide. Okay, I will start with this painting that probably most of you know or have ever visit in Vatican. It's called The Creation of Adam from Michelangelo. Okay, you can move. So I always guess what was the meaning of this almost touching the fingers of God and Adam. Okay, can move again. Thank you. So I don't know if the author Michelangelo has really an intention, but I guess, in my opinion, it could be that one, that God created man in his own image, but he did not wish to give him the capacity that defines the essence of God, that means the immortality. Okay, can you move? So, talking about the travel that I mentioned in the beginning, you can see the map of a Portuguese cartographer of the 16th century, one of the first representations of the world. Can you move again? Thank you. And here you can see also the representation of all the colonies that we had as in the age of the discoveries in around the world, and even if in small detail here, I don't know if you notice what I'm talking about, the famous Ormuz that every one of us could listen to the news every day. So we stayed there for almost 100 years. Move again, thank you. So one of the places that we arrived, it was Japan. So you can see here one of the first cartographic representations of Japan from a Portuguese cartographer, and also the book of a very famous writer, sailor, and also a priest, and he claimed to be the first one that arrived to Japan. It's called, his name is Fernão Mendes Pinto. He wrote a very famous book in the 16th century. Can you move again? Thank you. So, Portugal was the first nation, European nation, to arrive to Japan. Japan was known at that time the Empire of the Rising Sun, and they call us Southern Barbarians. In Japanese, it is the word Namban. So we arrived to this teeny small island. It's called Tenegashima, and it means in the Rifle Island. Can you move again? So one of the sailors that arrived to Japan with Fernão Mendes Pinto is Francisco Zeimoto. And Francisco Zeimoto was the one that allows the Japanese to know the gun power and the guns, and for that they gain that clan that have that knowledge first, gain much power than the other ones. And here you can see the house of his family. And I lived for almost 20 years in this small little village between Setúbal and Lisbon. And I also organized a conference talking about all this that is related to this small village that is called Paina. So Francisco Zeimoto was a member of that family that lived in this teeny house. All right, move, please. So another very important missionary, Jesuit, was Luís de Almeida. Luís de Almeida was also a physician and surgeon, and he was so important at that time that Japanese decided to give to this huge hospital in this island. It's called the city of Oita or Funai, and they built this hospital and give him to the hospital the name of the surgeon and the physician Luís de Almeida. Can you move? So Luis de Almeida founded a hospital, a medical surgery school, and everything that is here, including a leper colony, a nursery, and so on. And why he was so important to Japan? Because not only he cured many patients introducing new surgical techniques, but also he was very careful and empathetic to all of these patients that needed all the time. So can you move, please? So what is the main challenge that we face today in medicine? It's the integration of the technology in clinical medicine. And I don't think that we cannot see these two points of view. We need the physician, we need the patient, and only in the beginning and in the end of the process, and technology could help us a lot in the middle of the process, but we cannot use only technology. So you can move. So with this focus in mind, I have an idea, and I invited about 90 physicians of my country to write this book. It's only almost 800 pages book to help to promote the relation of doctor-patient relationship to an heritage of humanity, a world heritage of humanity by UNESCO, but we didn't get this objective till today. Okay, can you move? Please move the slide. Thank you. So with this in mind, I also publish several books. I'm going to publish a new one, and I have a site that is called with my name, and it's about medicine, culture, science, and humanization. Okay, can you move on, please? So in short, I have to say that we must assume that without subterfuge, that to diagnose, treat, cure, care, and of the patients, you need to behave with them with empathy, and without that, we don't be so useful to the world, to the patients, to the system, health system, and so on. So we have to respect ethics above all the purposes. Okay, can you move on? So in conclusion, here you can see a very famous Portuguese physician, also a researcher and artist, did a self-portrait of him. His house is transformed nowadays in a museum, and one of the two faculties of the city I was born, Porto, they give his name to that faculty. And to quote him, I can say he said, a doctor who only knows medicine doesn't even medicine knows at all. So next conclusion, next slide please, is also from a very famous neuroscientist, and the writer is also Portuguese, Antonio Damasio. He lives in US, in San Diego, and in a very recent interview that he gave, he said something that I agree myself, that technology discards the capacity the of the feeling. Life is being framed in a machine, and if the machine gains autonomy, the future will be terrifying. Okay, next slide, please. So I leave you with these two paintings that their meaning, that their message is all that I want to tell you. This is from one of the first paintings of Pablo Picasso, and this painting was from an artist that covered the first Great War, World War, and it tells us that nurse in certain circumstances is the most present person that can help patients. Okay, next slide. So I would like that something like this never happened. It's the touch of the two fingers of God and Adam, which means that we mustn't look for immortality as a goal of our technology. Okay, can you move on, please? So, in times of profound intolerance, let us always keep in mind the remarkable example of Luis de Almeida that was in Japan. He was from Jewish origin, and at the time of that the Sistine Chapel was painted, we had Inquisition, and this family was persecuted. When he arrived to Japan as a Catholic priest, a few years later, it happens the same thing to the Christians in Japan. So we have to realize that this kind of intolerance is not to be supported by anyone. So next slide. So we always have to do and practice the medicine like Luis de Almeida always did, treated every human being with respect, confidence, and empathy. That what is shown here in these two marvelous painting of a Spanish painter that lives in the islands of Spain. So the last slide, please. So I would like to dedicate this presentation to a very close friend of mine. He died just a few months ago. With almost 100 years of age. We were very close friends. He was a very famous clinician and also a writer. He interested in many other fields, including he was a very famous jazz pianist in Portugal. So this is my last slide, and I'm ready to answer any questions that you have.
in these digital health tools. Whereas if you see the low income